The Western Cape Health MEC, Nomafrench Mbombo, will assess the screening and testing centre at Paarl Hospital today. Mbombo is expected to accompany health workers at the Mbekweni township for door-to-door screening. Now, in the province, 2 people have died from coronavirus and 454 others have been infected. My colleague Lindsay Dentlinger joining us now from Paarl this morning. Lindsay, a very good morning to you. We understand that testing in the Western Cape beginning in earnest today. Give us some idea as to the start point. Where are they taking this to for the first time?
Good morning, Yuveka. Well, they actually started in the Cape Metropole over the weekend in Khayelitsha. They did start in a place called Happy Valley, started with screening en masse for COVID-19. Today we're in Paarl, which is the Drakensberg Winelands area of the Western Cape. There are 9 cases that we know of here in this area. I have just come from the Paarl Hospital, where the head of emergency services confirmed that 4 of those patients are being treated at that hospital, and where he showcased a triage centre, the Western Cape rolling out 17 such centres where they hope to separate people being screened, people who are possibly symptomatic with COVID-19 from the general hospital population and those coming to seek medical assistance for other illnesses. So that centre is now in the final stages of being set up. Here behind me is the Mbekweni clinic, and we expect later this morning for field workers to go door to door and begin screening people en masse. The head of the emergency services at Paarl Hospital, Dr. Aziz Parker, saying their concern really right now is the unknown, and the only way to determine what the scale of the spread of COVID-19 in this area will be to mass screen people.
All right, so the community screening are underway already then. Just take us through the actual process once people get to a centre like this, Lindsay. What's the process? And like you say, you have to separate those who are coming for other ailments, for other reasons to the hospital, and then those who need to be tested for COVID-19.
Well, at these triage centres, they want to obviously keep the queues moving as fast as possible. So screening people as quickly as they can, and those who don't present any symptoms, to move them as fast as they can out the door, and then separate those who do show symptoms. And the same with these attempts to send field workers into the area, street by street, house by house, to screen people so that they can identify people who are possibly symptomatic. And it's only those people who will go on to be tested. Of course, you run the risk right now of potentially screening somebody who shows no symptoms, might be a carrier of the virus, but that's just the way the process works right now, that they will only be testing those who obviously show symptoms of the virus. Again, the head of the emergency service is saying because this is cold and flu season, it's very difficult to determine for sure whether somebody is just presenting with ordinary symptoms for a cold or flu, and that is what they've been seeing so far at the Paarl Hospital, and those patients that they are currently treating for COVID-19, that they come and they present with other kinds of respiratory infections coupled with COVID-19. So that's really the process that they plan to follow here, is go through and determine which people might be symptomatic with symptoms for the virus, and get those people tested as soon as they can.
Well, like you say, Lindsay, some of the testing having been conducted this past weekend. So any idea as to were there any problems? What were the challenges? Did it go smoothly? Anything that they could have learned from this this initial phase of the weekend?
Well, I did see a flyer from one community where testing is also expected to happen in the city. We are some 60 kilometres from the city right now. Unhappiness in that community that they haven't been given enough information about what these field workers will be assessing, what they will be looking for, and just informing residents. They feel that they're not well equipped enough to know whether they might potentially be infected with the virus. And then, of course, we understand also some unhappiness in certain Cape Flats communities that they struggle at the best of times to try to get the medical treatment that they so sorely need. But now in an instance like this, this pandemic has brought out the urgency to upscale health measures, and so some unhappiness we understand from some communities that because the seriousness with which this COVID-19 pandemic is presenting themselves, you're now seeing health workers in areas where there's been an outcry for a very long time for better health services. But as you say, very much still in its first phases. It is really something that will be ramping up in the city in the coming days as they move from community to screen people.
And of course, those rural areas are also very, very important, Lindsay. We can't stress enough that the reach needs to be far enough in those areas.
Correct, and there are plans later this week to travel to those rural areas. This particular Winelands area, as we know, many farm workers here, and it is the second epicenter in the Western Cape after the Garden Route with the most number of infections. So right now the numbers might not seem so high, but at the Paarl Hospital, we heard a little bit earlier, is that they're really bracing for the unknown, and that is their greatest fear right now, that they might not have the facilities available to deal with the unknown. And as you say, rural areas, these are communities who work on the farms. As we know, agricultural production deemed essential services, so that continues. But with that, and given the change in season, also brings about the possibility of increased infections and dealing with an unknown factor of how many people might turn up at these hospitals that might not be adequately equipped to deal with large numbers of patients.
Okay, early days yet there for this process. Thanks very much, Lindsay Dentlinger. She'll continue to keep us updated throughout the day.